Hi, my name is Cindy Morris. I am ASA's Vice President of Development and Community Engagement. Welcome to ASA Live. Today I am with Ina Jaffe, and I am very excited to welcome her. Ina is a veteran NPR correspondent covering aging of America. Her stories on Morning Edition and All Things Considered have focused on older adults' involvement in politics and elections, dating and divorce, work and retirement, fashion and sports, as well as issues affecting long-term care and end-of-life choices. In 2015, she was named one of the nation's top influencers in aging by PBS publication Next Avenue, which wrote, "Jaffe has reinvented reporting on aging." Welcome, Ina, and thank you for doing this.
Thank you so much for having me.
Thank you. On January 25th, you published a piece, "Why Nursing Homes COVID-19 Legal Shields May Interfere with Other Cases," which, if people did not have a chance to hear, is available still at npr.org. And in that piece, you really talk about how 27 states have passed legislation that say nursing homes cannot be sued for deaths related to COVID-19. Can you explain a little bit about what brought on this legislation?
There is a concern on the part of legislators and some governors that nursing homes simply wouldn't be able to stay in business because they would be socked in with litigation. And the nursing home industry made a very persuasive case, I guess, that they would be in danger of going out of business. And they have continued to sort of push that arc that with interviews with their members that they would only be able to hang on for another year without going out of business. And so they have made a case that is persuasive for some legislatures and some governors.
Yeah, and I mean, it's interesting because you talk in your piece about one particular family, and I guess what caught my ear as I was listening to it is that this has been framed around policy, but ultimately this is a story about families. What does this legislation really mean for families?
I'm going to talk about the family that I profiled, just because that's a good way to start. It meant that theoretically they couldn't sue. They were caught up in that immunity shield that was passed by the North Carolina legislature, and they decided basically to sue anyway. They felt that this shouldn't happen to other people, and that there were reasons that they needed to have accountability, and that this would give them some closure. And I suppose I should say what happened to backtrack and say what happened to the family. The family's situation had nothing to do with COVID. They had their mother had a pressure ulcer or bed sore, as they're sometimes called, and she passed away. But she had that situation before anything to do with COVID. She was diagnosed in 2018, and the sisters tried to send her out to the emergency room, and they weren't accepted by the nursing home. They just rejected that pitch, if you will, and they begged them at many times to take them out. I counted in the transcript 4 times, legal transcript 4 times when they asked to send them out, and they refused. And they were, as I said, to come back full circle, they were prevented theoretically from filing a lawsuit, but they decided to do it anyway. And they wanted some closure, they wanted some accountability, and they are still waiting to find out if that will be accepted.
And I guess it's even harder because families that would have gone in, right? She had a chronic issue that had been going on for a few years already. They probably were used to going into the nursing home to check on their mother, to help their mother, to facilitate care for their mother. And with COVID, they probably didn't have access to do that anymore. So that's probably can only hinder the process of getting care for her mother in that prop, right?
That's right. That's right. And they had to demand that the administrators see them outside the nursing home and just come to the nursing home and have a conversation with them because they couldn't get in to see their mother. And they were disappointed by that experience.
Right. So how is this affecting the industry at large? Are you finding in your research and reporting that people are losing faith in the industry in a time in their lives when maybe they need it more than ever?
Well, there's faith and then there's blind faith. You don't necessarily want to put your faith in something that, doesn't deserve it. But on the other hand, there are other nursing homes that do a good job and they run the gamut. There's a whole spectrum, and it's hard to tell what your faith should be placed in.
That's actually an interesting situation, right? Are families starting to look for new options? A friend of mine just had her mother fall and break her hip. Instead of putting her into a long-term rehab center, she is paying for 24/7 care. That is a true privilege to be able to do. So what does this mean when we talk about equity in care? How can we, and what are we going to be seeing for protecting families who can't afford alternative options as they search for how to care for loved ones right now?
There is no system for long-term care in the United States. It's the wealthiest country in the world, and we have no system for taking care of our elders. And most people don't know that. I'm sure your members do, but most people do not know that. And it's a shanda, to use a Yiddish phrase. It really is. It really is a shame. It's a national shame to have that situation. And I think that it comes up from time to time in the commissions that draw up reviews, reports that then sit on the shelf gathering dust. But it comes up frequently, and there are surveys, people who pay attention to this kind of thing want there to be some long-term care, but so far there isn't that. And I don't know what is going to happen in terms of COVID, but it's so unlikely, I think, that there will be something sometime soon because COVID is very expensive.
Yeah, it's we all talk about the creation of the new normal, which is so important that we don't go back to the old normal because that was full of inequities and injustices. But the new normal is going to be very expensive. Um, and and so as we kind of look at all of this, I guess the thing that triggered for me as I was listening to your piece, and you hit on it before when you said, look, there's facilities that are across the spectrum, right? There are those that have done everything right and are, you wouldn't want to put your mother anywhere else, and those that you wouldn't want to step foot in. And I guess the thing is that they are being lumped together in this moment. And so, you know, what can the industry be looking at? They've done what they've done here in their lobbying efforts to protect a bottom line, and they've successfully done that. But what needs to be done to protect their public perception of them? How do we rebuild trust in this system, or how do we build trust in this system so that we can at least use the existing system that America does have?
Wow, that's a pretty big, pretty big subject. The American Healthcare Association puts out something every couple of days. It's about our healthcare heroes. It's about that people don't necessarily die of COVID. They recover from COVID sometimes, and there's, it runs the gamut. But they also have put out, put out press releases that, they're going to go out of business. They survey their members and they're going to go out of business, and that some members can only last a year or 6 months. And so they really sort of put fear into people, that those places that you go when you have no other choice are on the, on the edge, on the bubble, as we say in California. And so they've made people really afraid that on the one hand, they don't want to go there. On the other hand, they're afraid that the facility won't exist when they get there, when they need it.
Right. Yeah, there's a fear game being played in there. And on top of all of that, are statistics coming out now that so few of their employees are feeling comfortable getting the COVID-19 vaccine. And that can't add to that public perception.
Yeah, and especially since they pay those employees so little that frequently they work 2 or 3 jobs. And so they're more likely to be tracking, for lack of a better word, tracking COVID into the facility. And there's that danger.
Right. Well, I am so grateful that you took the time with us today to kind of talk more deeply about this. I hope that people take the time to listen to this story. Again, it was available at npr.org. If you missed it when it came out a couple of weeks ago, this is affecting all of us, whether we're in the industry, whether our families are going to be impacted by it now or one day in the future. But it is so wonderful of you to take your time to talk to us about this. And we hope you'll come back and join us again on another ASA Live. And again, just stay well and stay healthy yourself. And we hope that we'll talk to you again soon. Thank you.
Thank you very much.